Hi, I'm Dr. Bill Alison. Today I want to talk to you about Cellulaze. It's our newest laser cellulite treatment. It's the greatest, newest thing we got, and I think it really works because it's using laser therapy in an invasive manner like liposuction, using smart lipo technology to break up the cellulite bands. In these videos I'm going to show you in a minute, you'll see how we pre-op the patient and how it's very systematic how this is done, kind of to guarantee that you get great results. So look forward to seeing these videos. It's going to show you the pre-op and some operative videos, and I think it'll give you a good idea what Cellulaze is and what it can do for you. Okay, here's the marking completed for the Cellulaze, and what you're seeing here is you're seeing the red, which is a dimple, the green, which is a bulge, and you'll treat those a little differently when you do the Cellulaze. Here's a little dimple, here's a little dimple. So you want to release the fibrous attachments here, and here is just kind of, you want to do a little liposuction in those areas. So, and then these are the squares, and these squares allow you to be very precise with the energy that you use so that you are getting a good result with releasing the fibrous bands but also tightening the skin. And we actually use a little grid here, a little plastic grid, and just mark on it. It makes it very precise, but also gives a very consistent result. Here we go. This is the Cellulaze. You can see this is going to be the area that's got a little bit of bulge, so we'll spend some time deep on that. These are fibrous bands. We'll spend some time releasing those fibrous bands, and then we'll tighten the skin. And we'll do it square by square with a certain amount of energy to make sure we get a consistent, smooth result. Go. Listen carefully. You can hear the laser. And that's popping the fat cells, and the water's popping. Releasing that portion of the square septa. You can see it's moving real smooth now. And now what we're going to do is just heating up the skin. You might can see how the laser's a little brighter there. Why don't we turn out the light and we'll show you a little bit more of this. You see how the laser's really bright when it's close to the skin. And what that's doing is heating up the underneath the skin, which will cause it to shrink and tighten up that little area there. It's pretty much stayed in the square. You want to go a little outside the square to smooth things out. That's called feathering. Now you can see it goes a lot smoother now. It's kind of always broken all those things. Great. Okay, now we're going to go to the next square. And we'll use a certain technique to break these fibrous bands that are in red. So we'll do another 300 that way. Go. It's a little deeper. You can see that you don't see it quite as bright. And that's because we're doing fibrous bands and not just seeing the skin. We're trying to break up those deep bands that cause the dimple. That's why it's not quite as bright. We'll say it's going real smooth now. Now that you've seen the videos, you have a better understanding about Cellulaze. You saw the preoperative markings in the first one, which shows you how well it's done and how precise it is. And then you've seen the surgery, which, you know, when the lights are out, the laser is really cool. But what you really saw is that it's doing something. It's dividing those bands that hold the tissue down that cause the cellulite. It's going to melt some of that fat that causes the bumps. It's going to really smooth out the skin. And that's much better than anything topical, those massaging treatments you see, because we are actually really physically changing the skin. The studies show that 85% of women have cellulite. The post-op, or the studies, the trials for this machine show that 29% of people have increased skin tightening, 25% have thicker skin, and 90% are really satisfied with the results at a year. So it has long-lasting results, and you can see it's real surgery. Now, recovery still isn't too bad. Recovery, 2 to 3 days, you're back at work. Some bruising can be there, but overall, it's a very quick recovery with a great result. So I look forward to seeing and looking for more information on our website and these videos in the near future. Thanks. Bye-bye.